Hello everyone, I'm Dr. Faith Alcazaren. I'm a pediatrician and I am here to answer commonly Googled newborn questions. The first question is, do I need to sterilize bottles and pacifiers with every single use? Actually, with tap water in our country, it's not really the safest to ingest. And when you wash your bottles with it, you might want to think twice before offering the bottle to your baby unsterilized. We want to be extra careful when it comes to cleaning materials that are used for feeding baby. Clean all bottles and tins as soon as possible after use with hot soapy water, making sure there are no traces of milk on the bottle surface. Sterilize and dry the bottles. I recommend doing this for at least the first 12 months of life. Why is my baby's poop green? In the first 5 days of life, we expect a newborn stool to be a dark, mossy green color. This is called meconium, and it is composed of stuff the baby ingests within the womb. This clears out as the baby gets more milk from the mom into a yellowish, seedy color and consistency. If the stool is green and frothy, however, in an exclusively breastfed baby, it may also be a sign of imbalance of the foremilk and the hind milk. This happens when the baby is not able to get the fatty hind milk because of the incomplete emptying of breasts. Months later, if baby's stool color changes to green, it may be related to the mom's intake of food, which the baby could be reacting to, such as dairy, lots of vegetables, or any green food. If baby has started eating food, stool color can vary depending on his or her diet. How can I tell if baby is hungry? And how do I know if baby is getting enough milk? A baby has several soft signs of hunger which should be addressed early to avoid a stressful feeding session. Crying is a late sign of hunger. When baby means I'm hungry, upon waking up you might find baby stirring occasionally, looking really alert. Then she starts licking her lips, doing sucking sounds with her mouth, turning her head and opening her mouth, which is a reflex called rooting. Putting her hand in her mouth to suck it, or sucking on anything. And when baby means calm me, then feed me, baby becomes agitated and frantic, she panics, and she cries, turning red. You will know if baby's getting enough milk if after a feeding session, baby appears satisfied and content. Throughout the day, from the 4th day of life, you will also notice that baby is passing 4 to 6 wet diapers per day and 3 to 4 dirty diapers per day. Do not attempt to gauge this by pinching your breasts or pumping to see the volume that is expressed. This is very inaccurate. Are white spots on a newborn's face a sign of disease? Those white spots are sterile pustules that are normal variations in newborn skin. It's not recommended to apply anything on it as these will resolve spontaneously. How often should I bathe baby? In the first few weeks until the baby's cord falls off, I would only recommend bathing the baby's head and buttocks to keep the cord dry. Subsequently, baby can be given a bath thrice a week or even every day, depending on the weather. And if it's really a hot summer day, daily baths would be refreshing for baby.
When it comes to our babies, there should be no compromise.